Hey everyone, it's Petra here from Petra Fisher Movement. I want to talk to you today about breathing and core engagement strategies. And I'm doing this partly because there's a ton of confusion out there about exactly what good core strength and good breathing technique is. I'm going to tell you what my opinion is. It's probably going to contradict lots of other people's opinions, so get ready for it. Let me just start by saying that my goal with my breathing approach is long-term health. I do not care if you're good at singing. I do not care if you're good at sports. I care that you don't have a pelvic floor problem and that you don't have back pain and that you don't have digestive issues and that you don't have neck pain. So there are other strategies to breathe that will get you those other goals, and by all means use them for those other goals. But what we're talking about today is caring for your wellness in the long term. Okay? So breathing is a pressure system, and you have 3 pressure options in your system. You can belly breathe. I'm going to go sideways to you so you can really see that. So belly breathe. This is non-optimal in my opinion because it is destabilizing for your core. It turns off a lot of your core muscles. It puts a lot of pressure forward and down in your core. If you have pelvic floor issues, belly breathing is for sure not a good idea. I realize it is taught a lot in yoga. It is, in my opinion, not helpful because, and you can try it, you can probably feel in your pelvic floor, if you take a big belly breath, you can probably feel the pressure. You can even put your hand right onto your pelvic floor area, your pelvic area, and feel how it kind of puffs up when you take a big belly breath. That is pressure. In the long term, not very helpful. You could also have a strategy that uses a lot of lifting. So that's what's often called chest breathing. I don't like the word chest breathing because your chest is a big place. But what you're using here is your accessory muscles. You're using your neck, your shoulder, your trap muscles to lift up and create room in the top of your lung canister for air to go. That's not great for the long-term health of your neck and the whole upper part of your body. It's also pretty stressful for your body. So a time you're going to see that a lot is if you're somebody who sucks in their belly a lot, you're not going to have an option about being able to breathe anywhere except for into your neck and shoulders. So you're really going to end up in this accessory system all of the time. Is there a place for your accessory breathing? For sure. If you're running a giant race or if you need extra air for some reason, thank goodness we have it, but it's not a great default strategy. So sucking in your belly will cause you to use that upper air area, and that is not great for your neck. Sucking in your belly is not the same as using your core effectively, and we're going to talk about that in a second as well. So third strategy, the one I like, the one that is hardest for everybody because we're very sticky through our spines and rib cage, is what's known as 360-degree breathing, or I think of it as rib breathing. So that is a strategy where you have enough rib mobility that your ribs can expand when you breathe and that the air goes into your whole rib cage and then maybe a little into your belly after it's filled up your ribs. So that would be ribs expand to the sides, ribs expand up and down, ribs expand front and back. That back part is usually the hardest. The side part isn't easy for most people either. So you need rib cage mobility to work on that. So that's the barrier for that one, but it's well worth working on for your long-term health because that's going to deload your neck, it's going to deload your pelvic floor, and it's going to do lots of good for your entire breathing system, for your core, and just for your general spinal mobility, which is a great thing to have if you want a spine that feels great your whole life. So rib breathing. Super useful strategy. It's not belly breathing, it's not neck breathing. It's not that belly breathing and neck breathing should never be used, but the rib breathing is a great capacity to build so that that becomes your default option and the others are your options for when you need them. Okay? So what should be happening with your core during all of this? This is a really tricky question because at some level it depends on what the actual health of your core is right now. So the one thing you should never be doing is sucking in your belly. Let me show you what that looks like when I'm on my hands and knees. So this is the looking good in a bikini suck. So here I've pulled in my diaphragm kind of into my lung cavity using pressure. It's pulled all my organs into this kind of tight, immobile place where they're not getting the breathing input they like to have. I probably look much better in a bikini now than I did before, but I've turned off my core. And again, I'm forcing myself to breathe with my neck now. So if I let go of that, now what I'm going to do is I'm going to turn on my deep core muscles, my transverse abdominis, and I'm going to use breathing to do that. So what I'm doing in my setup here is I'm not doing a giant back arch. My ribs are lightly lifted up. My low back is neutral. I'm going to take a big breath and I am going to let it out slowly and with force, almost like if you had a garden hose and you put your thumb over the garden hose. So it's going to look like this. I'm going to relax my belly first and you're going to watch my TBA go on. So can you see how that's different than sucking in? That's sucking in, and it pretty much always moves my spine when I suck in. My TVA can turn on without any spinal movement, so I'm going to do that again for you. And functionally what's happening there is that my transverse abdominis, my deep core muscle, is squeezing out all the air as I exhale. It is concentrically contracting to squeeze out every single bit of air as I exhale. Do I want to be squeezing my TVA all the time? No, I do not. I want that muscle to be very reflexive. I want it to turn on. I want it to get loaded eccentrically, which is when it's actually expanding. I want it to get loaded concentrically when it tightens like that. I want it to do all the things, and I want it to respond to the world around me so that my core is doing what cores are supposed to do. So if you've been told that you should be holding core tension all the time and constantly bracing your TVA, that's a pretty vulnerable position because A, it's hard to constantly brace. B, your brain, your conscious brain is going to hold it to a certain degree, but is that the right degree? It's not the right degree if you're suddenly lifting up a giant thing of water, and it's not the right degree if you're swinging from a hanging bar, because it's a constant degree and your body needs to respond to inputs. So I really am not a fan of constantly bracing to a certain degree. What I want you to be able to do is to learn how to find that muscle and to be able to turn it on, and then I want you to be able to learn how to load slowly and effectively so that your core can respond to inputs. Now the other thing that your TBA can do is it can brace eccentrically. So that would be something like when weightlifters hold their breath and like really bear down and create a lot of tension and pressure through their core. And that can be a good stabilizing strategy for the right person if they do it the right way, because it is very stable when you create that pressure. The challenge with that strategy is that for many of us who have weakened pelvic floor muscles, if we start trying to bear down and push and pressurize, we're just going to go right into our problem area. So it's really a can of worms, and the concentric TVA engagement strategy is not as stable as the pressing out strategy, but could be more useful if you're someone who has a pressure issue in their core, such as a hernia or a diastasis recti or a pelvic floor problem. So what should you do with all of this information? Honestly, it is a lot to take in. There's a lot of exercises that you can do to work on all of this. The best thing to do would be to get on the wait list for my Take 10 program, because I teach you all of these skills and how to use them in my Take 10 program. For now, I just wanted to really clear up what is what. So sucking in, pressure problem. TBA engagement is a more suitable bracing position for your abs, but it's still not a great brace all the time. But you should learn what the difference is between sucking in and between bracing all the time. What maybe we can work on right now today is just learning how to let go of tension in the abs. Because sucking in, if you have a sucking in or a bracing habit, then you might not be very good at allowing those abdominal muscles to relax. And the first thing that those muscles need to learn how to do is to relax, because they can't work properly unless they're able to relax properly. So this is the belly release exercise. It's very simple. It's basically a quadruped position, but I like it more on my elbows because you can hang out on your elbows for longer, and you're just going to let it all go. You can let your spine go, you can let your shoulder blades go, and you can definitely let your belly muscles go. I know it can be really tough emotionally to do that, so if that's something you're encountering, I totally feel you. I am very aware that that's a huge issue in our culture, but this is a step towards learning to love our bellies in a really meaningful way, because You know, they do a lot of good stuff for us. They have babies and they digest our food and they help us breathe and they help us do fun stuff. And if you're always hiding your belly because you don't like how it looks, you're going to be limited in terms of how many of those other awesome life things you can do well and effectively. So it's a big step, and I know it's a hard one, and I feel you if this is hard. And if it's not hard, then that's awesome. And you're just going to practice letting go and seeing if you can allow yourself to release tension. So you can hang out here for 2 to 5 minutes. I'm going to come out of it now. It's not a very interesting exercise to watch. But what you want to think about when you're wandering around your daily life is just allowing your belly to be reflexive. So not adding tension by sucking in, not necessarily adding tension by consciously bracing, because it's just not a good long-term strategy unless you're working with a medical professional who's decided with your input that that is an effective thing for you to be working on right now. Your long-term goal should be getting a really reflexive functional core that can access pressurization in an even and helpful way, that can access TVA engagement, and that can access relaxation. So I hope that clears up some of the confusion. Feel free to get in touch with me. You can put a comment below. You can always email me as well. You can head to my Instagram. It's Petra Fisher Movement. That's a great place to reach out if you have questions. Okay?